Good afternoon, and thank you for listening to our presentation. Antimicrobial resistance is a public health threat. Self-medication is one factor that contributes significantly to the emergence of bacterial resistance. This is the behavior of using medical products without a prescription to alleviate minor diseases or symptoms. Numerous studies describe self-medication practices and determinants in Africa and Asia, but few have been completed in South and Central America.
San Lucas Tolimán is situated in south-central Guatemala and is home to a mostly indigenous Mayan population, including 17,000 people living in the town proper and an additional 14,000 people spread among surrounding rural communities. The average yearly income is about $3 per day. Semi-structured questionnaires were conducted in Spanish or Cachiquel via home visits. During these visits, we collected demographic information and information on antibiotic self-medication behaviors and perceptions. Study participants were identified by local health promoters working in conjunction with the Friends of San Lucas mission.
A significant portion of participants reported practicing self-medication with antibiotics for self or family members within the past 3 months. Although few people reported using antibiotics in animals, those who did typically did not have a veterinary prescription. In both rural and semi-urban settings, penicillins, such as amoxicillin, were the most commonly purchased and misused antibiotics, followed by sulfonamides and nitroimidazoles. In both rural and semi-urban locales, a majority of antibiotics were obtained locally. Respiratory and gastrointestinal complaints were the most common symptoms being treated with antibiotics. With the exception of genitourinary symptoms, self-medication was used for a majority of complaints. In animal populations, respiratory and skin complaints were the most common symptoms treated with antibiotics. Almost all respondents stated that they could define an antibiotic, but most definitions for use were based on symptoms, not on disease. Only one person knew that antibiotics were used to treat bacterial infections specifically. Overall awareness that self-medication could be harmful was high. However, most could not elaborate on the type of harm caused by antibiotic self-medication. Again, almost all respondents believed that there were also risks associated with antibiotic self-medication in animals, yet only 2 respondents believed that antibiotic self-medication in animals also posed a risk to human health. 40% of participants reported some knowledge of antibiotic resistance, but of these, less than half could define antibiotic resistance in a partially correct manner.
In this study, we demonstrate that a significant proportion of indigenous Guatemalan individuals practice antibiotic self-medication in both rural and semi-urban areas for minor complaints such as cough and sore throat. Surprisingly, self-medication rates were similar across rural and semi-urban areas, and most antibiotics were obtained locally, even in small rural villages. There were many reasons for people to self-medicate. These included difficulty accessing medical and veterinary care, as well as the high cost and time associated with a medical consult. Additionally, there was a perception that if a doctor had previously prescribed an antibiotic for similar symptoms, or if the disease were considered simple and well understood, one could use an antibiotic safely. Another factor contributing to antibiotic self-medication practices was the ease of access to the medications. Given high rates of self-medication in previous studies demonstrating resistant bacteria in Guatemala, we expect that antimicrobial resistant bacteria are present in San Lucas and the surrounding communities. We hope to build on the international partnerships established in this study to design sustainable programs to address antibiotic misuse in the area. These could include the development of targeted educational materials for health promoters or schools, initiatives to engage stakeholders such as pharmacists and store owners, or the implementation of Guatemalan law requiring prescriptions. Thank you.